something's knocking, something is screaming. It has different tones as the scan is going. So I can imagine being claustrophobic and in that infinite space, and then that whole noise is just surrounding you.
You like it.
Yes.
I'm not wishing you to talk for this.
Actually, we're not wishing for you to come to those, because most of this radiation is not something that you should just be exposing yourself to, especially CT scan. It's not like X-ray that you can use as a routine checkup for your benefits or our benefits as well. All right, so we're moving on to the next modality. Hi guys, welcome back to my YouTube channel. And today we're going to be talking about the things we wish patients knew before coming for an imaging scan. And today I have a guest here with me, my friend and colleague, Miriam, and she'll be joining us today as we discuss on this topic to give patients out there or anyone who's coming for an imaging scan better knowledge of what you should expect and prepare for before a scan, be it CT, MRI, conventional X-ray, or an ultrasound. So starting off with my friend here, Miriam. Miriam, can you tell us a bit about yourself and what you know about radiography?
Hi everyone, I'm Mariam Nasser by name, a radiographer and a graduate from Usman Danfodio University, Sokoto. I really love what I do. I really love my profession, especially when I make patients feel comfortable during their scans. That's why on today's episode, we are going to bring you what patients are supposed to know before coming to radiology department, to ease their scans and to make them feel more comfortable during any radiographing procedure.
So starting with the first and most common modality, which is your conventional X-ray, because this is the one that when you come to meet your doctor for the first time, they usually ask you to go and do an X-ray, and it's usually either a chest X-ray and then all forms of the body parts could be referred to for you to get an X-ray. And what would make it easier and faster for you to have this examination and scan done and get your results faster is that you come appropriately dressed. This cannot be overemphasized. Coming appropriately dressed with the right outfit that doesn't require you to change. Outfits that are most likely cotton fabrics that do not have beads, plain outfits without zips.
Yes, and all that is.
Exactly. Taking off your jewelry, taking off your earrings, your waist beads. Exactly. Because when you come with these things, you're going to be required to change. And this will take your time. And most patients usually feel uncomfortable having to wear a hospital gown because they most times feel like it's probably not washed well or who else has worn it. Even though here in our hospital, we make sure that our outfits are usually sanitized.
Most of the times, not even in case of the cleanliness. And the hospital gown is somehow opened. So
exactly, to expose some of your body and you feel uncomfortable.
Especially ladies, you know yourself.
Yes, bras with metal straps or metallic handles. So just when you're coming, you could wear a bra that has no straps or has no metal on that, so you will not be required to change.
All those are tampered with stones.
Yes.
Avoid them.
Avoid them before coming for an X-ray scan so that you don't waste your own time or make yourself feel uncomfortable.
Exactly.
So that is the most common one. Even for males, don't put on belts. Take off your boxers that have zip. Don't wear those types of boxers so that you won't be asked to remove it and then you'd have to feel uncomfortable.
Also, the reason that we ask you to remove all these metals is not for our own good, but for the image quality. Yes. Like when we came with this thing, like take a look at Tiffany's necklace. This thing will cast shadow. So when it casts shadow, and I will send it to the doctor. The doctor might end up misinterpreting the so at the end of the day they will ask Tiffany that she has something on her neck, she has to undergo operation. Hey, I don't know you. If you wear a thing to do standing, you can reflect on the image and the doctor can end up. Yeah, imagine you came along for scan, they end up saying that you have cancer. So you have to go and cry, do this and that. After they did another scan, they say, no, you don't have cancer. So you be like, that, they don't grab you you gave me high blood pressure before they even diagnosed me of having high blood pressure. Imagine you came with that stones and they asked me that after the result and everything, you have cancer. I mean, I can't sleep that night. How can I sleep? I will end up crying and all those things. So just take notes. Yeah, take notes and make it easier for yourself, make it easier for us.
Another noteworthy tip that you should know as a patient when coming for an imaging scan is that your cooperation is very much needed. You have to cooperate with the
Very
radiographer.
important.
Exactly, very, very important. You have to cooperate with the radiographer to reduce repeats and to reduce radiation exposure to even yourself. So when a radiographer tells you to stay still, stay still. Breathe in,
Just
breathe
follow
in.
the instructions.
Follow the instructions so that it will be
All
faster.
the things for your own good.
Yes.
We expose you once, faster and accurate. All this is for your own benefit. It enables us to have an adequate and accurate image quality that will enable the doctor to have your adequate diagnosis.
Now, the next modality we'll be discussing on is an ultrasound modality. So now the next modality we'll be discussing on is the ultrasound scan. One of the most common and basic requirements that is asked of you as a patient before an ultrasound scan is drinking of water. You will notice that when you come for an ultrasound scan, the sonographer will usually ask you to go and drink water. Even when you drank water, they will tell you, go and drink more water.
And some of the patients will ever like, doctor, I'm in Austria, let's do the scan for me, please.
Yes, but we can see that your bladder is not full because we need that water to go to your bladder so it can serve as an acoustic window for us to view the surrounding organs like your ovaries, your prostrates, your rectum, all of these parts that we're trying to examine. That full bladder is very important. So when we ask you to go and drink water, go and drink water. Drink more water. Even if we tell you drink a gallon, because it's for your own benefit.
Exactly.
And it will save us, time and save you time because there are some maybe a cyst or a calculi, whatever that we could see, which we could use your bladder as and a window to see that. We would not be able to see it when your bladder is not full.
Exactly.
So please drink water.
Probably coming without that full bladder, they may be hidden.
In hidden pathology, hidden disease,
like cyst,
calculi.
Probably they will hide. So without that full bladder, we can't see those things. So just be patient and obey.
Yes, just obey and let this work be easy for you and I.
The next thing before coming to ultrasound is you are not allowed to take anything. There is what we call nil per oral. You shouldn't take anything before coming to scan. At least you should have 6 hours before eating. Before you come to ultrasound, 6 hours you didn't eat anything. We are doing that for your own benefit because it will outline the bowel's profile without you taking anything. For you loaded everything, take fufu, take garri, take tea, take bread, and you come to ultrasound. You loaded everywhere. How can you see?
Yes, and most times you see those gases like all over your abdomen. And
exactly.
It can even obstruct.
Like your spleen, your kidneys, your liver. Without you taking anything, it will outline your bowels properly.
Yes.
Loading the bowels and coming for scan.
So exactly. So if you're preparing to go for an ultrasound scan, whether it's your abdomen, in fact, even obstetric scan, because sometimes even after your baby is checked, the sonographer may decide to check your surrounding organs. So still drink water, eat a lot before coming for your benefits, for our benefits as well. All right, so we're moving on to the next modality, which is the CT scan. Now, again, don't come with an outfit that has metal. Don't come with a clue with zip. Don't come with your necklace, your earrings, your bralette, your beads. Like, keep all those at home. Yes, keep them at home.
Exactly.
Of course, same thing. We use radiation here. We need to see your organs clearly. We don't want anything that will misinterpret or throw off, the accurate diagnosis that the doctor is trying to see when you come with those metallic outfits or.
And moreover, there is also nil per oral as for ultrasound. Even you're supposed to abide by these rules and regulations.
Yes, you're told not to eat before coming overnight. Abide to that as well. Now, a very important part of CT scan is the contrast. Most times when you come for a CT scan, although it's not all CT scan that requires this contrast, but you notice that you're usually told to drink something before coming. Most times it's put in Fanta, in Coke, so that you can take it because it's usually bitter, right?
Yes.
You're asked to drink those things so that when you come and your scan, it would properly outline your organs clearly.
As a layman, you know what is called as dye. So it will outline your structures very well when you take those contrast done doing it like that without that contrast.
Yeah, it opacifies it.
Yes.
It gives it this white.
You know how dye will beautify your clothes? That's
Yeah.
how it will beautify
Yes.
I'm so sure that
I love Mariam so much.
dye.
Mariam is funny and she has a very unique way of just talking about things. Like when we have conversations like this, how she always
sometimes you have to explain it in a way that they would understand it clearer. And
Yes.
So it just serves as your dye.
So make sure you take that contrast, and it's okay if you wake up in the morning and you feel a bitter taste in your mouth. That's the contrast, and no, it doesn't have any negative reaction on your body. Maybe some people can be allergic, but very, very few people are allergic. It is not a medicine. It's not, curing anything. It's not fixing anything. It's not taking away anything. It's just a dye. So feel comfortable to drink it and obey instructions as you're told.
And not all of them are taken through already. Some will be injected
when you come.
Exactly.
So be prepared to get some
your veins clearly, so it doesn't have any side effects. It's not 110% safe, but we are very sure that we know how safe it is and how important it is to you before even injecting it to you.
Right.
So I think we are wrapping it up with
one more thing. Positioning in seat is also very important. When you're told to lie down straight, don't raise your hand up, especially when you're doing a brain CT, even a cervical CT. In fact, when you're told keep your hands by the side, because CT uses a very high dose radiation compared to your conventional X-ray. So you don't want that to be
on that cooperation. Whatever you are asked to do, just do it.
Just do it.
We are not going to harm you.
Yes.
And even like I like something about the city. Even the cycle will be like, oh, inside this place. It's nice. It's cold. Exactly.
Just sleep.
Exactly. You like it. But
yes.
I'm not wishing you to talk about this.
Actually, we're not wishing for you to come to those, because most of this radiation is not something that you should just be exposing yourself to, especially CT scan. It's not like X-ray that you can use as a routine checkup. So when you're coming, abide by the rules to prevent repeats and to enable for good diagnosis that will prevent the doctor from sending you back to us again. So the last modality we'll be talking about is the MRI, and which stands for magnetic resonance imaging. And as the name implies, you hear the word magnets, and I'm sure anyone watching this right now definitely played with magnets as kids. Remember?
Yeah.
We used to have this black. Remember when I was primary 5 on the decks, we'd have these small magnets that would carry razor blades.
Yes.
And it was something we used to play with. And now think about this particular magnet in bigger magnitude and in a bigger capacity. A ferromagnet. It attracts anything metals, but there are different types of metals that it definitely attracts, like ferromagnetic metals, like iron, like steel. And most jewelries are usually produced with these metals, not gold. Gold, now on the other hand, gold is not a metal that is attracted to the magnets. But then, since we cannot confirm that what you're wearing is actual gold, you don't have a gold tester, when you're coming for an MRI, very, very important. Keep your jewelry at home, because we'll definitely be doing a metal screening. Take off your earrings, take off your jewelry, take off your bracelets, your bangles, even your ATM cards. In fact, it's much more important in MRI than other modalities. So metal screening is something we don't take lightly here in MRI. And another kind of screening that we do when we screen for metals, it's not just the metals you're putting on, it's the metals inside your body. So if you've had a surgery where you've had an implant on your hip, and using clips, cardiac pacemakers, when you have these things, it's very, very important that you disclose it to your doctor or to the radiographer on duty. Because there will definitely be a list of questions. When you come from an MRI scan, you'll definitely be run through a list of questions, of about 15 of them, to make sure that this...
We have some breakthrough rules or regulations with an MRI scan. You have to sign them.
Yes.
Then you have to bring your consent, someone will sign it for you, then you go for the procedure.
Yes, we take this very, very seriously, because if in any case you're putting on a pacemaker, you had an implant, and you're pushed into that machine, it could be a case of life and death.
When we talk about metals, MRI is the baddest.
It's the worst.
It's the worst.
It's not just about altering the image, it can even affect your life as well.
Exactly. And you know, even the machine is so cost, so we can't just afford someone to bring metal and destroy it.
Yes, because once that's metallic, either is your phone or something, your device, it's attached to that magnetic core. We can't take it out because we can't switch off the magnets. So your device is gone, or you would have to wait a while before it's taken out and given to you. So when you're coming, respect, you know, the rules and regulations. Keep your phone, keep your device. I once had a patient come for an MRI scan, and I asked him to take up everything, like his ATM card, his keys. He took up everything. He even took off his small phone, but then he kept his phone in his back pocket. And thankfully, I did notice. And when I asked him to, you know, keep it outside, he was like, "It's on silence." So I was like, no. It's not about it being on silence. Like, you have to take out your phone. And I think he was maybe scared or worried that, you know, maybe to be stolen, to be accessed. But we have CCTV cameras. Most MRI centers definitely have CCTV cameras. So your phones, your devices are well protected. When you're asked to keep them, do well to keep them.
The next thing that a patient is supposed to know before coming for an MRI scan is claustrophobia.
Yes.
Especially for patients that are emotionally challenged. Like, you know, the machine is so enclosed.
Yes.
And you will be left there for an hour or less than an hour. So actually, you need to be told about all those things. You have to know that we are not there alone, you are together with us. And as you are there inside, we are there controlling the machine. There is nothing that will be harmful for you.
And the machine will definitely not fall on you.
Exactly.
That's for sure.
Just like how narrow it is and how enclosed it is, and there is a button inside.
Yes, there's always a button that you're given
Exactly.
to press in case you need help or there's feel like you're endangered.
Yeah, then you can talk to us. We'll listen to you and we'll get back to you.
Yes, the scan can be paused at that moment, but it's still a delay on your time.
Yeah, if you use that button, you talk to us, then we'll understand what you mean.
Yes, and we'll assist you.
Exactly.
Yes.
And another one is noise.
Yes.
You know, Stephanie, that place is so noisy.
Noisy.
Even
with the first time I came into an MRI, I was like, what is that noise like?
Yeah,
so I can imagine being claustrophobic
and
in that infinite space, and then that whole noise is just surrounding you.
And you know, those that are inside the machine, those patients that we are scanning, they have the noise more than us.
Yes, they do hear it more.
That's why they have that headphones. That before even
so yes, we usually give you patients earplugs.
Apart from that, earplugs, and some will still perceive the noise. So you just know that we are together with you. It's not that we are harming you, we are doing it for your own benefit. Still, if you need anything, can you still use that button and talk to us down.
So that noise is completely normal, and it usually comes from the MRI gradient changing. It can sound like something's knocking, exactly, screaming. It has different tones as the scan is going up, but just know that that noise is normal. Nothing is happening. You're safe. So you should just expect this when you're coming for an MRI scan. And because it's long, you have to endure that noise. Sometimes you can even play music for you in your headphones while you're going through the scan. You can definitely request that. So when you're going for an MRI scan, you can definitely ask the radiographer on duty to play music for you in the earplug if they have that available. Some MRI machines do have that. So they can play music for you in your headphones. So you can lay there. If you're praying, you can pray. You can sleep. You can listen to the music. And while you
just stay calm.
Just stay calm. Don't panic. Don't move. Everything is fine. It'll be done in the
together.
Yes, if it's together. And also, you have to understand that MRI takes longer time than other modalities.
Confirm.
Yes, unlike CT or X-ray or even an ultrasound, MRI can take up to an hour. So during that time that you're in there, understand that it's normal. And sometimes you have to repeat sequences depending on your disease or your pathology or the indication that the doctor has sent. And if you need to cough, you need to swallow, you feel like throwing up, just let us know. But understand that it's normal for this procedure to take time. Yeah.
So the next thing also is contrast. As we explained in CT scan, there are also some MRI scans that need contrast, even them depending on the pathology or indication that you came with it. So if you experience any pathology that requires contrast, we will inject the contrast for you. The same as the CT scan is not harmful. It's just that it will outline the structures better than not using it.
So on the next video, we're going to talk about what to expect when coming for special procedures, because I believe this is the particular aspect that patients are very, very quick to come for, because they are scared. It's intimate. You have to, be accessed intimately. So we'll definitely be treating that in-depthly in my next video, because I believe that one requires more preparations and more mental preparation and physical preparations. For now, I hope that this video we were able to impact you with some knowledge on what to expect and what to prepare for ahead of any imaging scan you're planning to, go for. So thank you for staying to the end. If you did, we hope to do better and to serve you better with our next videos and next contents. So for now, thank you for watching. Wishing you a blissful week. Bye.